The small intestine channel is a yin-yang pair channel of the heart channel. It's also the hand channel of Tai-yang. Let's start with the primary channel. The small intestine primary channel starts from SI1 at the ulnar side of the little finger. It follows the ulnar side of the arm to SI8 between the olecranon of the ulnar and the medial epicondyle of the humerus. It goes up the posterior aspect of the upper arm to SI10 located at the posterior aspect of the shoulder. It goes medially, moving along a zigzag line to SI15. It crosses GV14, passes stomach 12, and goes down to intersect with the conception vessel at CV17 and connect with the heart. It further goes down through the diaphragm and connects with the stomach. It intersects with the conception vessel at CV13 and CV12, then enters the small intestine. There is a branch from the supraclavicular fossa that traverses the neck and cheek. It meets with the gallbladder channel at GB1 at the outer canthus. It goes to GB11 and meets with the Sanjiao channel at Sanjiao 20 and Sanjiao 22. Then it enters the ear at SI19. There is another branch from SI18 going to the lateral aspect of the nose and to the inner canthus to meet the bladder channel at bladder 1. The small intestine luo-connecting channel comes out at SI7 while connecting with the heart channel. It goes up the arm to the shoulder at LI15. The small intestine divergent channel comes out at the shoulder and enters the axilla. It connects with the heart and small intestine. The small intestine sinew channel starts at the dorsum of the little finger and binds at the wrist. It goes up the ulnar side of the forearm and binds at the medial condyle of the humerus. It goes up the arm and binds at the axilla. It surrounds the scapula, then goes to the neck, binding at the mastoid process. It goes behind the ear where a branch enters the ear. The sinew channel goes around the ear and binds at the mandible. It crosses the cheek, binds at the outer canthus, and goes up to bind at the corner of the head. Here are the key points. The primary channel goes to both inner and outer canthus. The sinew channel goes to the outer canthus. The primary channel and sinew channel enter the ear. The sinew channel binds at the mandible and corner of the head. The primary channel enters the heart, stomach, and small intestine. The divergent channel enters the heart and small intestine. Now let's look at what kind of signs and symptoms manifest when there is a problem with the small intestine primary channel. Painful throat, stiff and painful neck, swelling of the neck, swelling of the cheek, pain in the elbow, pain along the lateral side of the arm and scapula. The small intestine luo-connecting channel has excess and deficiency syndrome. For excess, there is loose joints of the shoulder and weakness of the muscles of the elbow joint. For deficiency, there are scabies and warts. Signs and symptoms of the small intestine sinew channel are stiffness and pain of the little finger, pain along the medial aspect of the arm, pain inferior and posterior to axilla, pain of the scapula that goes to the neck, sinew atrophy or swelling of the sides of the neck, pain of the ear radiating to the mandible. Now let's go over some major acupuncture points on this channel. SI1, 2, and 3 can clear both exterior and interior heat from the small intestine channel in the head. They are indicated for excess disorders of the sense organs. It clears the heat or ascending yang in the head, treating signs and symptoms of red eyes, tinnitus and deafness, nosebleed, pain and swelling of the cheek, and painful obstruction of the throat. But SI1 is also indicated for disorders of the breast, such as breast abscess and absence of lactation. SI2 is good at clearing toxic heat that causes pain and swelling. SI3 is an important point that can treat disorders along the spine such as occipital headache, stiffness and pain of the neck, pain of the upper spine and scapula, and lumbar spine. SI3 is also indicated for manic depression due to phlegm or phlegm heat and epilepsy due to wind phlegm. SI6 is used for acute, severe pain of the shoulder, scapular, and arm. This point is also indicated for eye disorders of deficient type, such as blurring and dimness of vision. SI9, 10, 11, 12, 13, 14, and 15 are in the scapular region. This group of 7 points is also known as the Big Dipper. For stiffness or pain of the shoulder, we can choose SI9, 10, 11, and 12. For stiffness or pain of the neck, we can choose SI13, 14, and 15. SI18 is a major point for the treatment of the facial disorders such as facial paralysis and trigeminal neuralgia. SI19 is an important point for ear disorders such as tinnitus, deafness, and ear discharge. If you want to learn more about acupuncture prescriptions according to patterns, please check our blog. The link is in the description. In the next video, we'll learn about the bladder channel of foot taiyang.